Hello everyone, I'm Mandil Sibakoti and I'll be talking about my experiment to see use of modified bioresorbable mesh made from P4HB polymer to limit complications after tumor removal surgery on soft tissue sarcoma, especially the tendons in animal model. The image on the left and the middle shows soft tissue sarcoma in the body, and the image on the right is the surgical mesh which I hope to implant after the operation. The roadmap of the presentation includes four specific categories: motivation and background, state-of-the-art, approach, and the summary. Motivation background. Soft tissue sarcoma is a rare type of cancer that begins in the tissue that connect and surround other body structures, which include muscle, fat, blood vessel, tendons, and nerves. In 2020, about 13,000 people were diagnosed with STS in the US. If it's not treated on time, tumor can then attach to nearby tissues or organs, making it not possible to remove because of its location and size. After treatment, the recurrence of lump that's been removed is highly possible. In spite of advances, the main cause of STS is still unknown, but like any other cancer, it's caused from errors in the DNA. There are certain risk factors known to promote STS, such as exposure to high radiation dosage, exposure to chemicals, and damaged lymph system from surgical removal of lymph nodes. In my research, I found that the issue of recurrence was not addressed at all. So most people, when they perform surgery to remove the lumps, once it grows back again, they have to go back to surgically remove it again. And other treatment methods like radiation and chemotherapy, people suffer a lot with the side effects over the period of treatment. And again, there's also a good chance of recurrence happening with that treatment method as well. So there was a need to find a new treatment method that can speed up recovery and reduce the chance of recurrence. State of the art. The most common way to cure STS is to surgically remove it. Then surgical mesh is used to provide additional support when repairing weakened or damaged tissue. The majority of surgical mesh currently available are from synthetic material or animal tissue. Implanting surgical mesh comes with some side effects, such as pain, infection, recurrence, adhesion, mesh migration, contraction, etc. If we're using non-absorbable mesh, which is synthetic mesh, it will remain in the body indefinitely, which means the longer it stays, the longer the chance of adverse effects happening occurs. So the use of bioresorbable mesh is preferred not only to reduce immune response, but also to promote fast healing. There are other treatment methods, mostly chemotherapy and immunotherapy. This involves injecting drugs into the body to kill cancer cells or to inject drugs that promote the immune system from acting against the cancer cells. However, going through many research articles, I didn't see a treatment method that includes combining two treatment methods at once, which is mostly using the surgical mesh and the anti-cancer drug at the same time, to not only achieve fast recovery, but to lower the risk of recurrence as well. Hence, I decided to pick this topic. The reason for choosing bioresorbable mesh is because they are naturally absorbing, so the body will absorb them completely over time. I found a company called BD that manufactures such mesh using their patented polymer called P4HB. This is made by fermenting E. coli in the manufacturing process that makes it completely organic, reducing immune response, and also proven to speed up recovery of tissue. For my experiment, I decided to modify the manufacturing of the polymer by adding anti-cancer drugs, namely bromocriptine and cabergoline, in the synthesis process. This way, now the mesh not only will have bioresorbable property, but also anti-cancer property. With these combined, now The operated region will be more resilient against cancer, and also foreign material will not remain in the body permanently. Next is the first aim of the experiment is to vary polymer properties to adjust its mechanical properties. Tendons are present in various body parts, so the mechanical properties of the mesh needs to be adjusted to accommodate the different body parts. Drug doses also affect mechanical properties, so to pick the best one, I decided to choose wide range of drug concentrations, and whichever results in the strongest mesh will be the one to choose moving forward. For simplicity, Achilles tendon was used for testing. Once we have the drug concentration, we'll next make 10 different samples with varying thickness, density, and number of layers. They will each undergo tensile testing, and the one closest to the actual Achilles tendon will be the one chosen. The next aim is to study the in vitro degradation. As we know, geometry of drugs will have varying degradation rates, so to find the best pattern, the mesh will be knitted in different patterns as seen in the image on the right. For in vitro study, the mesh will be incubated along with tumor cells in phosphate-buffered saline to mimic implantation inside the body. Using MTS assay, I'll also study the cytotoxicity of each particular mesh pattern. Over a period of time, tensile strength will be performed, and once the drop in strength is observed, that means the degradation has happened. So this way we'll be able to determine which gives the strongest pattern with the high cell cytotoxicity. Finally, animal testing is the best way to figure out the experiment went according to prediction or not. So lab mice will be used as test subject, which will be implanted with tumor cells. There will be control groups with no surgery, no treatment performed. There will be groups with only surgery performed. There will be groups with surgery and mesh implanted, and also regular mesh implantation. Over a period of time, the subject's vitality will be observed, along with monitoring the operated region to see the development in case any new cells start growing. Finally, in conclusion, the main aim was to develop a better treatment procedure against soft tissue sarcoma than the conventional method. We were able to determine the optimum mechanical properties based on the polymer properties. We were able to design the appropriate pattern to give high polymer degradation and cell viability rate. And also, animal testing helped us to determine whether it's feasible or not to move forward in clinical trials. Thank you for your attention. I am now happy to take your question through my Canvas discussion thread.